So currently there are multiple anti-CD3, CD20 targeting bispecific antibodies approved by the FDA for the treatment of patients with follicular lymphoma and large B-cell lymphoma, but also anti-CD3, anti-BCMA or GPRC5D bispecific antibodies targeting multiple myeloma cells. But there are also on the horizon many either ongoing or upcoming clinical trials trying to push this further. On one end, some trials are trying to target antigens other than CD20, BCMA, or GPRC5D. To this regard, probably the most promising at this time in the lymphoma space is represented by a bispecific antibody owned by AstraZeneca targeting CD3 and CD19 in a heavily pretreated population of patients with CD19 positive, either indolent B-cell lymphoma or aggressive B-cell lymphoma. The response rates were as high as 90% in the follicular lymphoma population, and the toxicity was quite limited. In particular, by utilizing a double step-up dosing, it was possible to see a meaningful decrease in cytokine release syndrome with a rate of about 30% and mainly grade 1. Though the further clinical development of this drug is currently limited by associated neurotoxicity observed in about 10% of patients, that we don't see as much in patients who receive standard anti-CD3, CD20 bispecific antibodies. As a next step, some companies are now trying to target multiple antigens at the same time with new constructs, including trispecific antibodies. Most of the efficacy data out there are in the multiple myeloma space. One of these drugs is able to target CD3, BCMA, and albumin, but we're still eagerly awaiting for more data in lymphoma with trispecific targeting in addition to CD3 and CD20, also either CD19 or CD79B. And then finally, we're also trying to engage other immune cells beyond T cells. So instead of targeting CD3, some new agents are now targeting CD16 on the NK cell side or CD47 to engage tumor-associated macrophages. And again, most of data out there are mainly in lymphoma with FMAF13, which is an anti-CD16, CD30 bispecific antibody. But we hope to see more, hopefully at the next ASCO meeting, about agent engaging macrophages for the treatment of lymphoma and myeloma.